Millions of people wake up every day with bloating, nausea, or that uncomfortable heaviness after meals. For some, it's occasional, but for many, it's constant, a silent struggle that turns every meal into a worry. You might think it's just overeating, stress, or something you ate, but sometimes the real problem is your stomach itself. The muscles in your stomach aren't moving food properly, leaving it sitting too long, fermenting, and creating gas and discomfort. Doctors often prescribe medicines to help the stomach push food along, but not all medicines are equally safe. Two drugs commonly prescribed for these issues are domperidone and levosulpiride. At first glance, they seem almost the same, promising relief from nausea and bloating, but the truth is more complicated. One is often gentler on your body and brain, while the other can affect hormones in surprising ways. Choosing the wrong one could make your discomfort worse or create subtle side effects you don't even notice until it's too late. So, which one is actually safer for your stomach? Let's dive in and explore the science, the risks, and what studies reveal, so you can understand exactly what your doctor is thinking when prescribing these medicines. Imagine sitting down for a meal and feeling full after just a few bites. Later, you feel bloated, nauseous, or even vomit. For many, this isn't occasional, it's daily life. The medical term for this problem is delayed gastric emptying or impaired gastric motility, meaning your stomach doesn't contract properly to push food into your intestines. Left unchecked, this condition can lead to persistent bloating, reflux that burns your esophagus, nausea, and a constant feeling of discomfort. Over time, it can affect digestion, nutrition, and even your mood. Lifestyle changes like eating smaller meals, avoiding fatty foods, or exercising after eating can help. But for many people, these measures aren't enough. That's when medications like domperidone and levosulpiride come into play. They don't just mask symptoms, they actively improve stomach motility, helping food move efficiently and reducing the discomfort that can dominate your day. For people struggling silently, these medicines can be life-changing. Domperidone is often described as a stomach helper. Its main job is to improve the movement of food through your digestive system. It works by blocking dopamine receptors, which allows stomach muscles to contract properly, pushing food forward and reducing bloating, nausea, and vomiting. What makes domperidone unique is that it mostly stays in your gut and hardly enters the brain. This reduces the risk of neurological side effects that other medicines might cause, such as drowsiness or movement disorders. Patients often report feeling relief within hours after taking domperidone, especially those suffering from delayed gastric emptying or functional dyspepsia. It's widely used for nausea caused by gastrointestinal problems, medications, or even migraines. Side effects are usually mild, including headaches or abdominal discomfort, and serious effects are rare. For many patients, it's a small pill that allows them to enjoy meals again without fear of bloating or nausea. Levosulpiride is another medicine designed to help your stomach move food efficiently. Like domperidone, it blocks dopamine receptors in the digestive tract, encouraging proper contraction and faster emptying of food. However, here's the important difference. Levosulpiride can cross into the brain more than domperidone, meaning it may influence hormones like prolactin. This effect can be helpful for certain patients, especially those who don't respond well to other medications, but it comes with additional risks. Possible side effects include headaches, dizziness, and hormonal changes, which are usually mild but need monitoring. Despite this, levosulpiride is highly effective for conditions like functional dyspepsia, reflux, and delayed gastric emptying. For patients who don't get relief from domperidone, it can feel like a lifeline, helping reduce the constant discomfort, bloating, and nausea that make daily life challenging. Both domperidone and levosulpiride aim to improve gastric motility, but their effects on the body differ in key ways. Domperidone primarily works in the digestive system, avoiding the brain, making it safer for patients with neurological risks or older adults. Levosulpiride, on the other hand, can influence the brain and hormone levels, which can be beneficial or risky depending on the patient. Doctors consider many factors when choosing between them, including the patient's symptoms, age, existing health conditions, and risk factors for hormone-related problems. Domperidone is often sufficient for mild nausea, bloating, or slow digestion. Levosulpiride is chosen when symptoms are more stubborn or when hormonal effects might provide additional benefits. And understanding these differences can prevent confusion and help patients feel informed about why their doctor recommends a particular drug. Clinical studies confirm that both domperidone and levosulpiride improve gastric motility, helping reduce bloating, nausea, and reflux. Domperidone is generally preferred for patients who need minimal brain effect, while levosulpiride is used when specific hormonal effects are acceptable or when other medications fail. Research also highlights that proper dosing is crucial. Even effective medicines can be harmful if overused or misused. For example, studies show that domperidone rarely causes serious cardiac effects if taken at recommended doses, while levosulpiride may require monitoring of hormone levels over time. Long-term studies suggest both drugs can be safe under medical supervision. Some but patient factors, such as age, heart health, and hormonal sensitivity, strongly influence outcomes. This is why self-prescribing these medications is risky. Studies reinforce that the safest and most effective approach is consulting a healthcare professional who knows your history and symptoms. Every medication has potential side effects, and these two are no exception. Domperidone is generally well tolerated. Some patients experience mild headaches or slight abdominal discomfort. Serious heart problems are rare, especially when taken at the recommended dose. Levosulpiride, however, carries additional risks because it can affect hormones. Patients may notice increased prolactin levels, mild hormonal changes, headaches, or dizziness. These effects are usually mild, but can be surprising if unexpected. Doctors often monitor hormone-sensitive patients closely, adjusting the dose or switching medications if needed. Choosing between the two medications involves balancing effectiveness with side effects. Domperidone is often gentler on the body, while levosulpiride is powerful but requires more attention and monitoring to avoid subtle complications. When it comes to safety, domperidone often has the advantage. Because it doesn't significantly affect the brain or hormones, it's generally safer for elderly patients or those with neurological problems. Levosulpiride, while effective, requires careful monitoring in patients with hormone-sensitive conditions. Other patients who need caution include those with heart problems, multiple medications, or pregnant or breastfeeding women. Even seemingly safe drugs can interact with other medications, thus amplify existing conditions or cause subtle side effects over time. Personalized advice from a healthcare professional is critical. Safety isn't just about side effects. It's about how the medicine interacts with your unique body chemistry, age, and health history. Careful monitoring ensures relief without hidden risks. Doctors often lean toward domperidone for its safer profile and effectiveness in relieving nausea and mild bloating. It's particularly preferred for patients sensitive to neurological effects or those with heart concerns. Levosulpiride is generally reserved for patients with more severe reflux, functional dyspepsia, or when other medications fail. The decision depends on individual symptoms, medical history, and risk factors. In some cases, doctors may even switch between the two medications based on treatment response. There is no universal best choice. Each patient requires a tailored approach. Understanding why your doctor chooses one over the other can help you feel more confident in your treatment and alert you to side effects that may need monitoring. Certain people must be cautious when using Domperidone or Levosulpiride. Heart patients, individuals with hormone disorders, those on multiple medications, and pregnant or breastfeeding women all require extra supervision. Even a seemingly safe medicine can interact with other drugs or pre-existing conditions in unexpected ways. Patients should provide their doctors with a complete medical history, report ongoing symptoms, and avoid self-prescribing. Subtle effects, such as hormonal changes or heart rhythm disturbances, may not show immediately but can cause complications over time. Hence, awareness and proactive monitoring are essential for safe use. With proper guidance, these medications can provide relief without hidden dangers. Domperidone and Levosulpiride are both highly effective for improving digestion, reducing nausea, and easing bloating. Domperidone is generally safer for most people, especially those sensitive to neurological effects or older adults. Levosulpiride is powerful and effective for persistent reflux or functional dyspepsia, but requires careful monitoring due to potential hormonal effects. The most important rule is never to self-prescribe. Your doctor knows your health history, current symptoms, and risk factors, and can guide you to the safest and most effective treatment. With the right medicine, careful monitoring, and proper dosing, relief from bloating, nausea, and reflux is possible. You can regain comfort after meals, enjoy food again, and live without constant stomach discomfort.